Next up, Rick Shorten, Chief Creative Officer for BioflightVR.
Hi, everybody. Thank you for including us, NVIDIA, in the GTC 2016 event. A heartfelt thank you also for including us in the emerging VR companies to watch. As he mentioned, my name is Rick Shorten. I'm the CCO/CEO of a startup called BioflightVR. We're working specifically in the diagnostic medical imaging space, and for the next few minutes, I'm just going to talk to you about what the team is building and why we believe it's important to the future of medicine. So traditional MR and CT data looks like this. Doctors and specialists will shuffle through these black and white 2D monochromatic images like a deck of cards looking for pathology or looking for damage on which they base their diagnosis. There are 3D modalities and 3D imaging systems that exist in current systems. Most of the residents and doctors and surgeons don't use it because they don't feel like it gives them any better view of their patient data than the flat 2D images. Also, that Windows 95 interface hurts my eyes. So at BioFlight, we think there's a better way to improve diagnostic accuracy by putting this data into a stereoscopic, immersive, interactive, collaborative environment in which doctors can improve accuracy, better patient outcomes, and also improving doctor optimization through the use of the platform. I'm just going to run this video. Oh, that went back. Sorry about that. I'll double click this. That works. There we go. So I'm just going to let a video roll behind me while I talk to you about what we're building on the platform side. This is just a mock-up of how a doctor might interface with our application. This is obviously internal prototyping. This isn't something that's live yet. But how are we going to build this all out, and how are people going to use it? Well, we're building a platform, as I mentioned, for diagnostics, education, and training. It's going to be obviously backed up by a very robust GPU interface, so thank you again, NVIDIA, for that. And this will be a user-customizable interface. There'll be valuable clinical data that comes out of the user experience for this. And it just gives them a way to share and collaborate with experts across the globe. So where you are in the world doesn't matter. More than one user can be inside this experience at the same time, annotating, examining data, and coming up with diagnoses. Why VR, which is always the question, and they're good questions. Just because we can build it in VR, why should we build it in VR? This is one of our doctors, by the way. I made him do that. Actually, I didn't make him do it. I asked him very nicely to do that. He has no doubt about the power of BioFlight and the power of VR and diagnostics, I assure you. But the question is, why would we put this in VR? And to that, I want to offer up a use case and a market validation number one. Google Cardboard saves baby's life. That is a great headline. If anyone here is from Google, congratulations. In its simplest form, this is what BioFlight is. And I'll explain the story here real quick. So a 3-month-old baby, she was a twin, was born with 1 lung and half a heart. And the doctors in her hometown had no idea how to operate on this little girl. And so her parents were told to take her home and make her comfortable and wait for her to die. So luckily for this little girl, her parents disagreed with that diagnosis, and they sought out a surgeon in Miami, a pediatric surgeon in Miami, who works with new and innovative technologies. He was able to take a scan of her heart, and inside of a VR 3D space, be able to identify the abnormalities in this little girl, and him and his team were able to come up with a surgical plan they felt confident would be able to repair her heart. So I'm happy to say that 5 months later, she's doing well and thriving like her sister, and this was all due in part to the ability of this team to be able to see things in VR that were not able to be exposed in regular setting. And that's what we're trying to create with BioFlight, giving users like that doctor a powerful new tool in medical imaging that lets us push the boundaries of what's possible in patient care today. So connected expertise is also an important part of our platform, and with my last 45 seconds, I'll talk quickly about that. So right now, medical services is generally geography-based. Where you are determines what access to expertise you have. We think that needs to change, and we want to be part of the movement that provides patients' expertise wherever you're located. So you should have access to great doctors in Boston or diagnostics in Boston just because you live in Poughkeepsie. So we want to be part of the team that changes that. And if we can imagine the future of diagnostic medicine and collaborative medicine in a shared environment, 3, 5, 10 years from now, that's the place where BioflightVR wants to be, and we're building that out with our doctors. The last thing I'll mention is that the Hippocratic Oath for doctors asks them to do no harm, but it also asks them to share the knowledge they've learned with future generations of doctors, and we'd like to think that a platform like BioflightVR helps with both of those cases. Thank you.
Great. Thank you, Rick.
Thank you.